Welcome to the tutorial for the Health Provider Toolkit for adolescent and young adult males. There's quite a bit of information in this resource, so it's helpful to go through the different categories to break it down. Essentially, the material is cut two ways, by type of resource and by the content of the resource or the health domain. In terms of the types of resources that are in the toolkit, they are primarily four. One is a checklist. It is an easy reference tool for healthcare providers. This also contains each of the domains, the health domains, that correspond with the health domains in the right navigation bar. And in fact, you can link directly to the content for each of these from the checklist itself. The second resource is a series of questions to ask patients, for screening questions for patients in each of the health domains. And you can see at the beginning of this section, there's some general recommendations first. For example, interview the adolescent patient without their parents in the room. Clearly explain your confidentiality policy right from the start. And further, there are suggested questions for each of the health domains. Healthy eating and physical activity, for example. Are you concerned about your body image or weight? And do you ever feel guilty about your eating? Information is supporting materials for each domain consisting of background information, practice tools, and references. Again, in healthy eating and physical activity, for example, on domain, you'll see methods, tools, and resources. And these are suggested interventions by other organizations, tools that they have developed to be used in the screening process, and other helpful practical tools. The reference section contains references. And then finally, the last category of materials is a video library. This library contains continuing medical education and patient education materials in each of the health domains. For example, healthy eating and physical activity, healthy eating for providers and for patients. Now, material is arranged across the top before we get to the health domains. There's a tab that talks about toolkit development. That talks about how the toolkit was developed, the rationale behind it, and some of the methodology, and who participated in the project. The second is a toolkit tutorial. The third is project background, which gives more extensive information about the need for the toolkit and how and to address the issue of adolescent and young adult male health. And then finally, the video library. An important piece of the toolkit is this comment section here. Because the toolkit will be changing constantly as new material comes in and is posted to it, we're suggesting and strongly encouraging users to provide us with comments so we can improve it over time. Now on the right-hand navigation bar are the health domains. And as you can see, there are 5 under health history and screening, and 4 under physical examining and labs. Using healthy eating and physical activity as an example, each domain material is broken out into subcategories. The first being the key points. The purpose of this section is so that the provider, if the provider does nothing more than read something in the toolkit, these are the key points in this section that are the most important. And again, as we discussed before, there are questions in each health domain to ask the patient. The second area is methods, tools, and resources. And again, as discussed before, these are resources that have been developed by others. And finally, the reference section. We hope this tutorial has been helpful and would encourage you to disseminate it to your colleagues and to provide comment. Thank you very much.